So we're going to work the lower legs now. I'm going to start with going through the new point locations. So in your practices, I want to start with you practicing the point locations. When you know where they are, you can just incorporate them in the full treatment. So first of all, we're going to start with me describing where the yang meridians are. So we're going to start with the bladder meridian, which is underneath the back of the leg. Now, because we're going to be working in this position, I want you to see how to work it. It's handy if you've got a bolster just at the back of the knee so you can access the back of the knee. So if we start with bladder 40, which if I bring my finger underneath, it's in the centre of the transverse line behind the knee, a really prime point for all back pain and for any bladder meridian issues. So we come from bladder 40, then to work the bladder meridian, we're actually working our way down the back of the gastrocnemius muscle until we get to the point of the sort of below the belly where the muscle curves round where the two heads are. And right in that point we've got bladder 57, which is really good for any leg cramps and releases the whole channel. So from the central point of the calf to bladder 57, the bladder meridian then curves round and we're coming back down to bladder 60, and you know where that is, and bladder 67 on the toe. So we work this point, this meridian from underneath, but it's really good to start working them by locating the points. Then we're moving on to being able to show you where the gallbladder meridian is. This comes down the IT band, it comes down the side of the body. You want to find for our first point the head of the fibula. Now just below the head of the fibula is gallbladder 34, which is really good for all sinews and tendons and really releases the whole of the gallbladder channel. A lot of these points are described as releasing blockages in the whole channel. So we're working down from here onto the peroneus muscle, and then we've got gallbladder 39. Now before that, the gallbladder meridian has a little zigzag before we get to that point. You'll see when we do the releasing techniques how we cover that whole area. But bladder with gallbladder 39, this is 3 sun, 4 finger widths above the external malleolus. So you do your 4 finger widths, and it's often a real point of tension with ankle strain, sinew problems, sciatica. It's often a very tight point, so it's a really good point to work. And then we go down to our usual points, gallbladder 40 to gallbladder 44 off the 4th toe. So then we're moving on to the stomach meridian. So we're coming back up to the knee, and we're going to add in stomach 35. So just below the patella, in a little dent there is stomach 35. Really good for knee problems and any stomach issues. And then we're going over stomach 36 because it's such an important point. I know you've done this before. So 3 sun, 4 finger widths below that is stomach 36. We also found it by sliding up the side of the tibia bone and falling into the dip. So then we've got the stomach meridian coming down again. There's a little movement through here, but when we do the releasing work, you'll see where we cover the whole of that channel, and then crossing the front of the foot this time. Remember, going to the second toe, the outside second toe, and stomach 45. So those are the 3 yang meridians we're doing in the lower limb, and now we're moving on to the yin meridian. So I'm showing you from this angle so you can see a bit better. So we're going to start with kidney. Again, coming along sort of quite close to the back of the leg. Remember where kidney 3 is, kidney 1 in the sole of the foot, kidney 2 just below the navicular, then we had kidney 3, and then it circled around here, and then we had 5 sun above kidney 3, we've got kidney 9. So we measure our 4 finger widths for 3 sun, and then add 2 thumb widths, and we've got in the sort of softer tissue here kidney 9, and that's called the guest house. So it's really good for encouraging in ancestral spirit and we also work it in fertility for encouraging in the spirit of the baby. So then we come into the soft tissue for kidney, and then we're up into the medial side of the transverse crease of the knee, and then in between the two tendons is kidney 10. So again, very good for all knee problems, but also it's a very tonifying point for the whole kidney channel. So we've got kidney coming around here, and then we're moving on to liver. So remembering, liver meridian starts on the lateral side of the big toe and comes up to liver 2, liver 3, liver 4, and then the next point we're going to work is liver 5, which is 5 sun above the medial malleolus. So 4 finger widths for our 3 sun, 2 thumb widths, and then we're on the bone. So we're higher than spleen 6, and we're onto the bone, and it's often quite a tender point, so it's really good for releasing liver key stagnation. So it really can be a tender point, but really worth working. Then the liver meridian curves into the calf, and you can often feel that springy, tendony feel till it comes to the back of the knee, further forward than kidney, but it's still on the transverse crease, and it's just sort of near the head of the tibia, and it feels like onto a belly of a muscle. And you've got liver 8. So we had kidney 10, liver 8, and this is really good for tonifying the blood. So it's really good for all tendons and sinews, for any blood issues in the body. So then we're gonna go to our third yin meridian and come to spleen, our beloved spleen, and we start on the medial side of the toe. We know spleen 1, spleen 2, 3, 4, we've got 5 here, then we know where spleen 6 is, and then we're moving up through to, I'm going to show you spleen 9 first because it's easier to locate, and then we're going to go to spleen 8. So spleen 9 is slightly lower down and in front of the kidney 8, and it's just coming in to underneath the head of the tibia, and there's a soft indent here. It's one of the key points for dampness in the body, so it helps resolve any damp issues in the lower burner, and it's a very good point for spleen. So then below this transverse crease of the wrist, we've got 5 sun below that, we've then got spleen 8. So 4 finger widths again, 2 thumb widths down, and into the soft tissue we've got spleen 8. Really good for blood issues again, and another good point we use in a lot of fertility protocols, so it's a nice point for you to learn. So moving on from the locations, so now practice your locations so you're clear where they are. We want to go into the massage treatment. I'm going to use a little bit of the Arnica Intensive I mentioned in the manual and on the Zoom technique tutorial, just so I've got a bit of glide. And then I want to start off with my pushing movement. So I'm going to start off pushing upwards, and then I will change that for some of the meridians. I'm going to show you the yang on this side and the yin on this side. Obviously I'll do both on both sides. So to just start with, because it's right here, I'm going to work the stomach just in a warm-up position. What I want to do is I want to stroke down the stomach, because the energy of the stomach flows down and the energy of the spleen flows up. So I'm just showing you, this movement is an earth meridian movement. So we're just, I sometimes also call it the earth sandwich, where I'm holding the spleen and the stomach, and I'm pulling down the stomach and I'm pushing up for the spleen. So it's an earth balancing movement. But I can incorporate that in my warm-up. Also, I'm going to show you from here so you can see, I also incorporate my rolling movements. So any of the yang meridians, and you can do this with your forearm, you can get a quicker movement with the hand. And often in the tweener, when we look through the tweener, they use actually quite quick movements to warm up. We could also do our grasping movement. So if you're doing it from the bottom of the couch, probably looks a little bit more like that. So warming up, that will have warmed up stomach and gallbladder. Then we want to warm up bladder, and we're using the grasping and opening up through the back of the leg. And then on the yin meridians, we're using that rubbing, circling motion that we learned in the tweener moves. And that's a bit softer on the yin meridians. It's good if we want to disperse them. We can then come down, do our joint rotations, remembering joint rotations are really important as the ki gets really stuck in the joints. So you'll be spending a lot longer doing these movements, but we want to make sure that we free the ki in all the joints. Then we're going to go to working more specifically on the meridian pathway. So you do your warm up, and then I'm just going to show you starting through bladder. I'm holding bladder 40, and then I'm connecting either to bladder 60 or bladder 67. 60 works really well for me because I've got a nice grounded contact. So when we start the meridians, we want to be focused and mindful. So hold points and connect. This also helps your client connect into the meridian energy because you're slowing things down here. Then I'm using fingers underneath. So this is like the thumb movements we're going to use in a minute. I'm tracing the pathway down. We'll do that several times. Coming to here, then I can come round here to 60. You can even just be smoothing out the pathway, coming down, pulling off the little toe. So see how that feels. If it feels really tight, the bladder doesn't feel too tight here, then we're going to do a lot of grasping and releasing. So using those tweak and grasp movements to release the bladder. Then I'm going to move to working the gallbladder. So I'm finding the point. So once you know where your point locations are, you can go straight into the meridian pathway work. But you always use your points to connect aspects up. So I can hold 40 at the bottom, 34 here, and I'm thumbing down this pathway. How does it feel? Feels a bit tighter through here. So if it's quite tight, I'm going to move quite quickly and maybe not hold so much. And then I'm going to do my cross releasing work. So this really, remember we've got this little kink in the gallbladder. This cross release releases the whole of the pathway. So it's tighter down this aspect, so I can keep working that. I can then do some kneading with my fingers. Also that quick thumb work to release the channel. Now this works really well on the yang channels. They tend to be a bit more robust. On the more tender yin channels, we're going to be a bit more careful. So then again, going to my stomach meridian, I'm holding down here. You can hold off the toe as well, or you can hold stomach 44 in the web of the foot. I'm gonna find stomach 36, and then you can hold lower down, and I'm coming so that I want to be focused here. I want to feel. Now this is definitely the most jitsu of the meridians, or the fullest of the meridians. So I'm trying to find that feeling. So there's definitely worth releasing through the stomach. So pulling off the toe really helps. And again, I'm going to work a bit more. So what I want to feel is tissue release. So I want to feel a change in the tissues. So we're going to alternate doing. So what I want you to be able to do is improvise, add in techniques to work for change in the meridians. And this is what you're going to write up in your 3 case studies. I want you to know how you've adapted it is the key aspect. So we soothe off. We can soothe off with circles or gentle pushing techniques again. Then I'm going to show you the yin meridians on this side. So starting with kidney. So you might need to get up and down, and you can work around. I'm getting up and down to show you. I'm going to start, and I often find, depending on my angle, if I'm from this angle I'm going to use my fingers. If I'm from down here, I can just gently cup with my thumb into the kidney meridian. So I can go either way. I can start from down here, start from 1, 3, and then cup up the kidney meridian. Now that feels a bit more tired and depleted, so I would mainly do holding work here. I'd hold the points and hold the meridian. If it did feel firmer, I would tend to do circling rather than the cross techniques, because it's a bit more of a tender area. But you could do circling, and you could also do firmer thumbing if it needed releasing. And then I'm going to come to liver, work my liver 3, come up to my liver 5. How is that feeling? Coming up to liver 8, a little bit tighter. So I can release the points and do a bit more releasing work. It's a bit fuller, so I'm going to release through, but I could just do gentle holding and holding points. So remember, you can stay and hold. How long we hold is how long's comfortable, but think about holding at least for a very slow breath in each position. Coming down. Then moving on to spleen. So connecting with spleen 1, coming up, connecting with spleen 3, and then it's useful to connect to 9 and 8. So again, this feels a bit more tired, so we can get some lovely cupping motions and do a lot more tonifying. If we wanted to release, then we could release the points, which release the channel, and do nice circular movements. So we're using them in a bit more of a gentle way, and that feels more gentle. And again, we finish off with our nice pushing, pulling movements. We could do a spleen stomach sandwich on this side. Release the stomach, support the spleen up. And we can, then end. We would have done more footwork on this side at the beginning. We can end with slower footwork where we can slightly twist and pull off each toe, clearing the energy in the channels. I like to do this in a gentler way than they do in tweener. And then we can end with things like the water-wood balance hold, which is liver 3, kidney 1. Or we can end holding the heels, in which we're balancing out bladder and kidney.